Hi, so I'm going to be doing my video over the upper and lower airway structures. So there is obviously two parts. There's the upper airway and the lower airway. So the upper airway is all of the structures up above the glottis, and the lower airway is all of the structures below. So in the upper airway, you've got the nasopharynx, the frontal maxillary ethmoid sphenoid sinuses, the oropharynx, the laryngopharynx, and the larynx. The nasal pharynx is the upper portion of the pharynx. It's the part of the throat that connects the nasal cavity to the mouth. It is located behind the nasal cavity and above the soft plate. The oropharynx is the middle section of the pharynx, the throat. It is located behind the mouth and above the laryngopharynx. The laryngopharynx is the lower part of the pharynx that serves as a crucial junction where air, food, and water travel to their separate pathways in the larynx for breathing or the esophagus for digestion. It extends from the epiglottis, the flap at the base of the tongue, the landmark that we look for whenever we're working on intubations, down to the upper esophagus. So the larynx lies in the anterior neck. It contains the vocal cords, and the vocal cords are where the ET tube is going to pass through whenever you're doing your intubation. It's kind of a good landmark to look for to make sure that you know that you're going towards the lungs and not towards the esophagus. The lower airway has the trachea, which is the air passage from the larynx to the lungs. It's got the carina, which is the ridge that separates the opening of the right mainstem bronchus and the left mainstem bronchus. And then from there, you've got the right and left main bronchi branch, which goes into the secondary bronchi, the tertiary segmental bronchi, and the terminary bronchioles. And you've got your alveoli, which are the functional units of the respiratory system. That's where most of the respiratory gas exchange takes place. They are surrounded by a fine network of blood capillaries and coated with pulmonary surfactant that helps prevent the alveoli from collapsing. Sometimes babies can be born without surfactant if they're really premature. Luckily, in hospital settings, we can introduce that now. Adults that have something like COPD or something else where they don't have enough surfactant, as far as I'm aware, there is no way to replace it in adults. They also have the mediastinum, which separates the lungs. It includes the heart, blood vessels, trachea, esophagus, lymphatic tissue, and lymphatic vessels. You've got the pleural cavity that surrounds both lungs, and the primary function of the lungs is respiration. To protect all of those vital organs, you've got your ribs. So you've got 7 cervical vertebrae, 12 thoracic vertebrae, and although the lumbar doesn't help protect, there is 5 lumbar vertebrae as well. They just don't protect the pleural cavity where the lungs and everything else sits.